Kia ora. It's my pleasure to introduce the 2017 annual report of the New Zealand AIDS Foundation. Bringing the report together has been a wonderful opportunity to reflect on the many successes the Foundation's achieved over the past 12 months, as we embark on our journey working towards our aspirational vision of ending HIV transmission in Aotearoa by 2025. This year's being the first year of implementation of the new 2016 to 2019 NZAF strategic plan. The role of condoms in HIV and STI prevention is critical as we move forward, and we've worked hard to find new and sophisticated ways to promote condom use for casual sex. The I'm On phase of the Ending HIV social marketing program reinforced the central role that condoms have to play, and we've distributed over 600,000 condom and lube packs across the country to bars, sex-on-site venues, sexual health clinics and primary care providers. Alongside condoms, the NZAF has played a critical leadership role in educating communities around pre-exposure prophylaxis, or PrEP, another critical tool in the HIV prevention toolkit. We've partnered with Auckland Sexual Health, the University of Auckland and Body Positive on the PrEP demonstration project. We've held community forums across the country educating communities about PrEP. We've partnered with clinical services to increase the number of general practitioners who can safely and effectively prescribe PrEP. And we've made an application to Pharmac to fund PrEP for those who need it most. We know that if we're to reduce the number of HIV diagnoses in New Zealand, we need to reduce undiagnosed HIV in the community. And to do that, we need to find accessible and appropriate ways to increase rates of HIV testing. We've worked hard to do this over the last 12 months, and the service has administered over 3,500 HIV tests in innovative environments such as sex-on-site venues and at community sporting events. Alongside staying safe and testing often, we're promoting early treatment for people diagnosed with HIV. An enormous success this year was the removal of the CD4 threshold for treatment access. As a result of cross-sector collaboration and advocacy, people diagnosed with HIV can now access treatment immediately if they choose to. This is not only a wonderful thing for their long-term health, but is also a game changer from an HIV prevention perspective for those people living with HIV who are able to achieve and maintain an undetectable viral load. Alongside HIV prevention, supporting people living with HIV remains a core component of our work. Our therapeutic team has had over 1,000 interactions with people living with HIV in the last 12 months, both in a one-on-one therapeutic environment, but also through delivering group therapy. We've delivered HIV education workshops to health and allied health organisations, and we've led a positive framing around HIV in the mainstream media, dispelling myths and combating HIV stigma at every opportunity. Alongside implementing the strategic plan, I've led the organisation through significant change over the past 12 months. This change was necessary, both to position us as fit for purpose in delivering the strategy, but also to make us financially sustainable into the future in an increasingly competitive funding environment. Regrettably, we needed to say farewell to a number of staff through that process, and I want to use this opportunity to thank them for their commitment and service. In particular, I want to say thank you to Tony Hughes, our Scientific Director. With us for over 30 years, Tony made a genuinely unparalleled contribution, not only to this organisation, but to the wider sexual health sector in this country. His legacy continues to inspire us all. This is a truly exciting time to be working in HIV prevention and care. It's also a very challenging one. I feel enormously privileged to lead the fantastic team at the NZAF, and I thank you for your ongoing support. I hope you enjoy reading the annual report, and I look forward to working with you in the coming year. Thank you.